Ladies and gentlemen, today I would like to take this opportunity to share my study entitled Containment and Mitigation Measures of COVID-19, a scoping review. My name is Mr. Kuay, Research Officer from Institute for Public Health, Ministry of Health, Malaysia. In December 2019, an epidemic of COVID-19 began in China, and the number of countries infected by the virus has continued to rise significantly. This phenomenon has led the WHO to declare COVID-19 as pandemic on March 11, 2020, and has urged all affected countries to adopt the containment and mitigation measures in order to control the disease from spreading. For our information, the containment aimed at preventing and the disease from taking hold, such as encompassing early detection, isolation, and care of people already infected, with careful tracing and screening of their contacts, while the mitigation aimed at reducing the impact and its incidence, such as social distancing strategies, cancellation of large gatherings, reducing non-essential use of public transport, and closure of school. The objective of my study is to determine the control method used in containment and mitigation of the COVID-19 virus from the affected countries, and to ascertain what are the best methods in COVID-19 transmission control. My study methodology is a scoping review approach in searching, screening, reviewing, data extraction was applied based on framework by M.S.A. and O'Malley. A comprehensive search strategy was performed, which include published scientific journal, unpublished work, grey literature, using the match term of novel coronavirus 2019, N.C.A, COVID-19, Wuhan coronavirus, SARS-CoV-2, containment, mitigation, and control. Two reviewers independently screened all references from the articles and then reached consensus on which met the eligibility criteria. Non-English language articles were excluded as the translation was not practical. Data from the article were extracted and summarized on a standardized form with the data reviewed by both authors. The result, a total of 996 sources of evidence identified from the literature search and grey literature hand search were included in the review, representing the type of containment and mitigation from 4 regions, such as Western Pacific and Southeast Asia, European, Eastern Mediterranean, and the Americas. After completion of the initial screening, 922 articles were excluded for the following reasons, such as did not meet the inclusion criteria and article was a duplicate. The remaining 72 articles were screened at the full text level. After full review for relevancy, 41 articles were excluded and a total of 31 articles were selected for scoping review. After more than 1 month of the containment and mitigation control measures taken by the infected country, most of the countries managed to reduce the COVID-19 cases from spreading in the communities. However, the two most successful countries that managed to control this pandemic were Hong Kong and South Korea, while the United States of America and Brazil are the countries yet unable to significantly reduce the COVID-19 cases. This review revealed that all countries affected by the COVID-19 had implemented multiple containment and mitigation measures to reduce the impact of disease, thus making it difficult to measure the effectiveness of each individual method. A combination of multiple control measures is necessary, since this could increase the success in reducing the transmission of the COVID-19 disease. In addition, the aggressiveness of the government effort and the compliance among the population are the main factor for the effectiveness of the containment and mitigation measures implemented. And lastly, the effort should be directed at the creation of standard guidelines to improve the containment and mitigation effort, considering the characteristics of the virus and community acceptance. Thanks.